In addition, more Americans are now living below the poverty line, more than we've seen in more than a half century, 46.2 million. Joining us this morning from Capitol Hill, Senator Bernie Sanders, an independent from Vermont, and Republican Senator Orrin Hatch of Utah. Gentlemen, good to have both of you with us this morning.
Good to be with you.
Senator Hatch, I'd like to begin with you. I know that you would like to repeal health care in its entirety. You feel that it's bad for the economy. Yet we know that to most Americans, the health care system in this country is broken, and they need some sort of change. So what would you then replace it with, especially based on these latest census numbers?
Well, I think the way to really handle health care would be to use 50 state laboratories where the federal government provides money, some regulation, but the states themselves work out their own health care in accordance with their own demographics. If we did that, we would find a much more efficient health care system. We'd find the states much happier. Right now, according to the CBO, we're going to have a $1.1 trillion in additional taxes and penalties, $700 billion in deficit over the next 10 years. We're going to have $311 billion in extra spending. We're going to have, I mean, you could go right down the line. It's just a disaster. And it would be much if we would turn to the states, have the federal government help, basically by providing the money and some ideas, but not have this one-size-fits-all really socialist medicine approach that literally isn't going to work.
So you don't feel that works. Senator Sanders, you are, of course, the chairman of the Senate Health Subcommittee. You led a hearing yesterday talking about this. Statistically, there isn't a huge difference in the number of people who are covered. Is the plan actually working in your eyes, the health care plan that went into effect, or should there be a different approach, perhaps like Senator Hatch just offered?
Well, here's the reality. We are spending twice as much per capita on health care as do the people of any other nation, and yet our health care outcomes in many ways are worse. We are the only nation in the industrialized world that does not cover every man, woman, and child in terms of health care as a right of citizenship. We spend more, we get less. And that's because we have insurance companies in the middle of everything whose goal in life is not to provide quality, cost-effective care to the people. It's to make as much money as they possibly can. Where I do agree with Senator Hatch is I would like to see some states, perhaps the state of Vermont, lead the country in going forward with a Medicare for all single-payer program which says that every man, woman, and child has health care as a right. We can do it in a much more cost-effective way than is currently the case.
Senator Hatch, would you, the plan that he just proposed that he'd like to see in his home state of Vermont, I know you want this to be individual to each state, but is that something that you think would work in a number of states?
Well, I think Vermont would be a lot better off if they could do that, and I think Bernie's right on that. You know, the fact of the matter is 50 million people aren't being covered by this act. The federal government, look, all we have are nameless, faceless bureaucrats back here making decisions for everybody in America. It'd be a lot better to bring this program closer to home, where the people within the states, in accordance with their own demographics and their own needs and their own problems, can solve these problems. So I got to tell you, according to the CBO, 800,000 lost jobs because of this Obamacare. Premiums are going to go up $2,100 per family. I mean, come on, it isn't going to work. You've got the almighty federal government hasn't shown us they can handle anything like health care.
Well, with all due respect to both of you, sir, a lot of the American people feel that the folks in Washington who they elected and put there to do a specific job have not shown that they can do that job without a lot of infighting. You two both agreed on certain points this morning. I can only give you each about 15 seconds, but do you think that this is something, even if there need to be changes, that could be worked on and even discussed when there are differences between all the different folks in Washington? Senator Sanders, I'll give you the first word on that.
Well, yeah, the answer is yes, but the idea to say that the people don't like federal health care programs is totally wrong. Medicare is a strong program. It has its problems. Go out and ask the American people. Senator Hatch may want to cut back on Medicare. I don't know. I don't. I want to strengthen Medicare. I don't want to see it cut. I don't want to see the eligibility age raised. The American people support it, and I want to make sure it stays strong.
Senator
Hatch?
Well,
let's just be honest about it. These programs have not worked the way they should. They're running us into bankruptcy. We're going to wind up without being able to cover people.
Can you work together, though, with folks on the other side of the aisle?
I think Bernie and I actually could work together, even though he approaches things far differently and believes in the federal government a lot more than I do. I believe in the state governments, and I think in all reality we can do a better job.
If you guys say you can work together, we will look to you for that.
Going forward.
Good. Okay.
Senators, we appreciate your time this morning. Thank you.
Thank you.
It's good to see them getting along nicely.
It is nice to see them getting along. I'm going to hold them to that.